health scenario can be improved, what are the requirements, and what is your view on the current healthcare situation in India?
Right, right. So, if we are actually looking at the healthcare delivery systems in this country, in spite of everything going against us, we are still doing all right. But there's a whole room for improvement. So, for that, we need to know what are the gaps. So, we have a three-tier system. We have a primary, we have a secondary, we have a tertiary level. Now, tertiary level is very well developed, but it is clustered in the metropolitan cities. So, what's the percentage of population? So, it's catering to about 30% population. The 70% of population who are there in the outreach, in the rural, in the semi-rural, in the semi-urban areas, which the population which is socially, economically, geographically dispersed across the country don't have an access, don't have an availability, and don't have the affordability. So the three main things that we are lacking in the country is the access, availability, and affordability. Three things that the government should be acting upon. And the other thing which we need to take care is what are the India centric problems. We are not going to do research, as far as I'm a neurologist, I will talk to you about the neurological issues. I don't want huge amount of infrastructure or money being spent on diseases wherein the whole world is interested. Yes, in India also there could be a global burden, but there are a lot of diseases which are completely India centric where the world is not interested, which includes these communicable disorders and also certain varieties of non-communicable diseases, say for example brain attacks or strokes, which are happening in young people. So it is catering to the societal burden. So the concentration should be the magnitude of a disease burden in the country. So I'm not so concerned about the rare diseases, I'm concerned about the common diseases. Number two, that which are more India centric, more commonly occurring in the country. And number three, not just the treatment and also obviously the preventive aspects. So if you just take stroke per se, now this can be eminently prevented. It includes awareness at various levels, not just the public, also the medical, the paramedical personnel, and in the healthcare delivery systems, we need to build in the prevention aspect as well as the treatment aspect and as well as the rehab aspect at each level. And we need to have the standard operating protocols which are also to be focused at what can be done at primary level, at what point should the person refer to a secondary level, what point should it go to at a tertiary level. And these SOPs should be almost like idiot proof, very simple, enactable. And one of the big things about an emergency medical system is a transport. And fortunately now we do have the emergency ambulance systems. Rajasthan also has that, and I'm so happy that it is coming up, and I think a lot of good things are being done. But because we need to also the be aware of what good is happening, otherwise it is demoralizing all the time. At the same time, we need to better, and there is a whole lot of there's a big window of opportunity at the current times with the current interest in this, that we can do this.
I also want to know your viewpoint in two topics. One is healthcare insurance and other is IT health, because these two themes are the key themes of today's events. What do you take
See,
on
IT, we probably are the kings of the world, right? So when we have our the best brains managing the IT sector across the universe, why not in our own country? So and I think an IT would play such an exemplary role. It is of such humongous magnitude. It can change the landscape of healthcare delivery systems. Take in this telemedicine. I'm not even talking about huge big rooms with big TV screens and there is some dedicated personnel all very busy looking. No, I'm looking at smartphones. Just tweaking the smartphones, having an app. You give an idea to an IT specialist, he will develop an app for you for picking up a disease, response to a disease, how to chart off. For example, now stroke ready hospitals in a geographic area. The map they make, and they will give that app to the ambulance driver to pick up a stroke, and he will know from point A to point B which would be the shortest route to go to stroke ready hospital. Those apps are being developed, and who's developing them? My IT people are developing them. So they have a huge role. Insurance, frankly, to me, as a citizen of this country, health is not a luxury. Health is my birthright. So ideally, this health should be a state property. State should ensure it. But well, there are countries in this world. Cuba it is free. Canada it's free. So Canada is developed. Cuba is developing. So we can take cues of as to how health you can't barter health. It can't be haves and have nots. Health is a fundamental right of a citizen of a country. So if I can do that, if I can make health free for all, I mean that is the greatest achievement that one can have. But then if you are have limitations, then yes, health insurance would come in a big way, and we've had even these private players who are making a big contribution. But ultimately it should transfer, actually the outcome should be that health should be free for all. There should be no economic and geographic barriers. How this insurance system will ultimately cater to that, well, I'm not the best judge, I'm just a clinician here, but that would be my objective.